smokers, high level of problems because people live in big town, yes, city, but city sometimes near factories, a lot of problems with air, and high risk of COPD today. What this is, for example, lungs of the child and lungs of the adult people. Yes, you see, color, another color, because a lot of macrophages in our lungs with some products, yes, exogenic products, yes, and for example, coal dust. This is coal dust, yes, coal dust. Besides today, you see emphysema, for example, this is, and you see very big balls. It's bullous emphysema, yes, bullosный emphysema. Bronchiectasis and bronchiectatic disease. For example, this is lumen increase, yet cylindrical bronchiectasis or saccular-like. This is bronchiectasis, this is, for example, or cylindrical. Yes, you see patients with COPD and bronchiectatic disease. Yes, with increased risk of cor pulmonale and with increased risk of problems with heart work. Because if you have problems with our lungs, through a few years, maybe problems with heart. Two organs together. Problems with lungs, problems with heart. Problems with heart, problems with lungs. Yes, it is? Yes, it is. And today, discuss, for example, carcinoma is beautiful carcinoma of the lungs with nodulus, and beautiful metastasis to the lymph nodes. You remember lung carcinoma, especially squamous cell carcinoma, with first metastasis to the lymph nodes, first time. But after maybe go to another parts of the body. If you think about a peripheral carcinoma, small cell lung carcinoma, maybe wide spreading to a lot of parts of our body. A lot of parts. Today, causes of the death maybe after metastasis, yes, because primary part maybe surgery, chemotherapy, radiotherapy, and stabilization. But if you have metastasis, adrenals, bones, brains, metastasis, it's not very good for prognosis. It's not very good for prognosis. How many slides today? Two slides only. Yes, and names of these slides? Yes, it's chronic bronchitis with bronchiectasis and emphysema. Yes, it's example of emphysema. If you see rupture of his balls, bullous, emphysema, what do you see after rupture? What happened with air? Yes, out, and in which part of the maybe our yes, pleura. And remember about pleura, maybe inner part, visceral, and what names of this? If you see a lot of yes, a lot of in our pleural cavity, a lot of air. Pneumothorax. Yes, it is pneumothorax. If you see pneumothorax, maybe compression of our lungs. And what names if you see compression of our lungs? Yes, if you see pleura, in pleura you see air, but lung tissue may be compressed by air. What names of this? Maybe collapse or atelectasis. Atelectasis. If you see small part, maybe more often use atelectasis. Questions? Small break and draw our slides. Small break and draw our slides.